Hello and welcome to ZTalk. Today we have Dr. Bharat Shah with us.
Hello.
A very prominent and senior nephrologist practicing in Global Hospital, Mumbai. Doctor is also a director of Institute of Renal Sciences at Global Hospital and a managing trustee of Narmada Kidney Foundation. Dr. Bharat Shah is the one who has started the hypertension clinic at Global Hospital, and his area of interest is primarily hypertension. So welcome, sir, to our talk show. So, sir, we're here to, give a message to the practicing doctors, the physicians primarily, about hypertension, because that's your subject that you are interested into. So, any comments about prevalence of hypertension in your clinic setup or maybe in general?
Yeah. So, hypertension is a very important subject that we should keep in mind. We are here for a transplant meeting, but let me tell you that there is a lot that we can do at preventive level, and this can happen if we create awareness about high blood pressure. We run Narmada Kidney Foundation, and we have screening camp programs at different residential societies, at organizations, in the clubs, and we have data of more than 6,000 people whom we have screened, and we find that amongst the ages, hypertension is prevalent in almost 50% of the cases. Out of this 50% cases, 50% are poorly controlled, and 50% are not even aware of their having hypertension. So that is why hypertension, which can be easily managed, is unfortunately not being managed in general population. And that's why I think it's very important for us to educate masses about hypertension.
Absolutely, sir. So when it comes to treatment, I'm sure, in your kind of a setup or a practice like in Global Hospital, you must be getting the patients who are already probably having a lot of complications. So any molecules, preferences or anything in general as a, nephrologist, as a specialty which you think?
So first of all, I would like the masses to understand that hypertension is a problem which is by and large to be managed by nephrologists, the kidney doctors. Many times people with high blood pressure tend to go to the cardiologist, but it is a nephrologist who investigates every hypertensive patient in detail. As is true for everything, even hypertension must be properly evaluated to find out if there is any underlying cause. And if you find out the underlying cause, you can completely eradicate it. Hypertension is a very important factor for nephrologists because if you control hypertension, you can stabilize the kidney function and prevent many people from having progression of their kidney disease. So that is the reason why hypertension is an important part of nephrology practice, and we run this hypertension clinic. Now coming to treatment, I said that in some cases hypertension can be due to underlying cause. You find out the cause and you treat. But in many cases you may not be able to identify a cause, in which case we call it primary hypertension, right? Which is the drug of choice for primary hypertension or essential hypertension? Currently, calcium channel blocker is the drug of choice. But in our nephrology practice, we also take into consideration another parameter, which is the amount of protein loss in the urine. So when the protein loss in the urine is high, like more than a gram in 24 hours, and someone has high blood pressure, then our choice will be an ACE inhibitor or angiotensin receptor blocker. Whereas if the protein loss in the urine is not high, then our drug of choice is a calcium channel blocker.
Absolutely, sir. So now that we're talking about calcium channel blockers, so there are many generations of calcium channel blockers have come and gone. Some are there and are called as a gold standard. So any comment on the newer molecules that are there, which probably are more and giving more flexibility to you to treat it and giving other more benefits? Any comments?
Sure. So I have seen calcium channel blocker coming up from beginning, starting with nifedipine, and then it came to amlodipine, then it came to cilnidipine, and now we have newer molecules like azilnidipine.
Right, sir.
as new and new drugs come, some of them, they certainly offer more benefit. Now, what is a common problem that we see with calcium channel blockers? There are two main problems that we see. Some of them develop edema, which is disturbing, and the other problem is tachycardia. Now, these two problems were seen more commonly in the drugs which came initially in the form of nephropin and amlodipine, and the newer drugs. And with the use of newer drugs, we find that these two complications are less. There is less of tachycardia, there is less of edema. There is another added advantage of these newer ones because they block both the ALN and receptors, that they act at the glomerular level, where they alter the renal hemodynamics, which can also have an important role in slowing down the progression of kidney disease.
How does that happen, sir?
So, when your kidney function is poor, as an adaptive mechanism, at the glomerular level, you have an efferent arteriole which dilates, which is a compensatory mechanism to maintain the glomerular filtration rate, and the efferent arteriole constricts. This increases the glomerular capillary pressure. So, although it might maintain initially glomerular filtration rate, in the long run, this hemodynamic adaptive change is detrimental for the kidney.
Yes.
So, by altering this or resetting this renal hemodynamics, they can slow down the rate of progression of kidney disease.
So the newer molecules are promising in that, so as you are saying.
Yes, that's true.
Any particular dose that you recommend for?
So I would normally start with 8 milligrams a day. Of course, it will depend on the degree of hypertension, and then I go on to 16 milligrams per day. Right.
So a combination or maybe
So normally we as nephrologists would start with calcium channel blocker, as I said, if the proteinuria is not much. And if we can't achieve a good control, then we combine it with an angiotensin receptor block.
That's I think that's a great information that we have. So any take-home message for the practicing physicians, doctor, who see most of the cases from your side?
So the most important take-home message is, one, that hypertension is highly prevalent in our country, and it is an important factor contributing to progression of kidney disease. It is an important factor which increases the risk of cardiovascular mortality. And just controlling high blood pressure can significantly minimize this morbidity and mortality. It is not enough to use a medicine. I teach all my patients to monitor blood pressure at home and to ensure that with the drugs, the blood pressure is controlled. So good home monitoring is also very important, because I said that 50% of patients with high blood pressure are uncontrolled. And if we can do that, we can substantially reduce the number of patients developing kidney failure and number of patients developing cardiovascular disease in the form of myocardial infarction and cerebrovascular accidents.
Wow, that's great. So that was Dr. Bharat Shah for this ZTalk. Thank you, doctor, for giving your valuable time.
Thank you.
Thanks.